Botulism is a rare, serious, and dangerous condition caused by the anaerobic bacteria called Clostridium botulinum. It produces a toxin that attacks the body's nerves, leading to a neuromuscular blockade. This condition is most common in infants, but can also come from external factors such as poorly canned food. Symptoms, which include trouble swallowing or speaking, dry mouth, and facial weakness, usually begin 12 to 36 hours after consumption. Botulism can also form from unprotected wounds, leading to an infection. Most recently, a specific type called iatrogenic botulism has become a concern for people who consume too much botulinum toxin for cosmetic or medical purposes. This may sound familiar as it comes from Botox, a trending cosmetic procedure to smooth facial wrinkles. So, how does botulism occur? As stated, botulism can occur through several different ways, such as through food, wound infections, or excessive use of botulinum toxin. Regardless of how the patient contracts the condition, the end result mostly remains the same: difficulty breathing, muscle paralysis, and possibly death. With that said, the pathway the toxin takes is also the same. But first, let's take a look at how neurotransmission normally works. In a nerve cell, vesicles storing neurotransmitters travel through the dendrite to the axon and dock at the cell membrane with the help of snare complex proteins. The vesicles then fuse with the cell membrane and release acetylcholine into the neuromuscular junction. According to Cleveland Clinic, acetylcholine plays a role in involuntary muscle movement. Thus, when it is released, muscle contraction occurs. Now, how does Clostridium botulinum affect this? Well, when the neurotoxin enters the body, it first interacts with epithelial cells in the gut or airway to undergo binding, transcytosis, and delivery to the general circulation. In other words, it first binds to the skin and blood vessels, then goes through transcytosis to be taken to the nerve cell in the form of a vesicle. When it arrives at the nerve cell, it binds to specific receptors to enter the cell membrane. Endocytosis, the active process in which a cell forms internal vesicles and allows for the absorption of various molecules from the extracellular fluid, then occurs. The light chain of the neurotoxin then separates from the heavy chain and translocation occurs. This simply means that the light chain moves through the endosomal membrane and enters the cytoplasm of the nerve cell. The light chain uses enzymes to cleave specific snare proteins called SNAP25. This prevents vesicles carrying neurotransmitters from docking and releasing acetylcholine, thus leading to the inhibition of muscle contraction. This is highly dangerous as the diaphragm, which is a muscle, assists the lungs in breathing. As such, muscle paralysis of the diaphragm could lead to respiratory failure and eventually death due to lack of oxygen. With that said, there is a way to combat botulism. The patient is injected with antitoxin, preventing the toxin from causing further harm. However, it does not heal preemptive damage. As such, it is important to know the signs and symptoms, as it works best when given early on. Once the antitoxin prevents further harm, the nerve cell can reproduce SNAP25 through protein synthesis and return to normal function. Botulism is a serious condition, and it should be treated as such. Its impact on the nervous system can lead to muscle paralysis, respiratory failure, and in severe cases, death. However, note that there are ways to prevent it from occurring in the first place. Make sure you know the proper techniques for canning food, and for new parents, ensure your baby's environment is safe and clean, as the bacteria usually comes from dirt and may turn airborne. By staying informed and cautious, we can protect ourselves and the ones we love from this life-threatening illness.